The psychiatric nurse role came about because of the need for nursing care in hospitals and asylums where large numbers of patients were housed. Nurses were typically trained by the hospitals or the asylums. According to the American Psychiatric Nurses Association, or APNA, the first training school for psychiatric nurses was at McLean Asylum in Massachusetts, and it opened in 1882. By 1913, nurses at Johns Hopkins University had created an educational program for psychiatric nurses. Published in 1920, Nursing Mental Disease was written by Harriet Bailey, and it became the first nursing textbook for psychiatric nurses. While serving in the Army Nurse Corps during World War II, Hildegard Peplau began to form a new theoretical framework which would transform psychiatric nursing. In 1952, Peplau published the book Interpersonal Relations in Nursing, which brought to focus nurses' supportive care and interactive therapeutic relationships with patients. Peplau promoted the idea of listening to and talking to patients as part of the therapeutic approach. The National Mental Care Act of 1946 created a path for federal funding for nursing programs, and Peplau was instrumental in developing the first graduate program for psychiatric nurses at Rutgers University. And the advent of first-generation antipsychotic medications began in the 1950s, and following this, the process of deinstitutionalization of psychiatric care patients. The American Psychiatric Nurses Association was founded in 1986. In the 1990s, called the Decade of the Brain, there was a shift to the biomedical disease construct of mental illness. In 2008, the Mental Health Parity and Addiction Equality Act was implemented, requiring insurance companies to reimburse for mental health treatments the same way as they would for medical care. The stress of the COVID-19 pandemic brought rise to social and psychosocial factors that affect society and have challenged psychiatric nurses. According to a survey of U.S. adults, the advent of the COVID-19 pandemic brought an increase of mental health symptoms like anxiety, which increased by 3 times, and depression symptoms, which increased by 4 times. Likewise, 26% of respondents reported stress and trauma-related symptoms, while 13% reported increased substance abuse. Coupled with the decreased access to medical facilities due to a lack of COVID-safe face-to-face encounters, this paved the way for the evolution and the use of virtual healthcare technology. Psychiatric mental health nursing is a field that continues to adapt and evolve with the demands of society. The future of psychiatric nursing rests on the strength and the resilience of psychiatric nurses who have shown their ability to give caring support to diverse patient populations, even while adapting to increased societal demands and new settings. Advanced practice nurses, or psychiatric mental health nurse practitioners, are a key to mental health promotion and prevention of stress-related disorders. Use of new communication technologies to provide services through the medium of telehealth allow the PMHNPs to effectively reach rural and economically diverse communities. Psychiatric nurses must continue to strive to develop their therapeutic relational connection with the patient, as this, according to Peplau, is the heart of psychiatric nursing.